Good evening, everyone. I'm Dr. Roth here at Revive MedSpa at Eye Care Specialists. Tonight, we thought we would present or talk a little about um, Upneeq, which is a drop to help uplift our eyes, and we're having an uplifted virtual event. So why don't we go ahead and start rolling the slides here. So as you can see here, if you have questions, you can, at the bottom of your screen, there is a chat bar, and you can go ahead and click on the chat and put in a question. And when it comes time, we have some people watching for them, and we'll be able to get some answers hopefully out to you. So, do your eyes look tired is one of the big questions. And what you can see here is, wow, very nice sculpted eyebrow and upper eyelids, nice eyelashes. If you take a look on the right side, you'll notice that the eyelid is just a little lower than the one on the left side. And so that eye looks, for some people, they might say a little smaller, but looks a little more tired. It has a little drooping to it. If we can go ahead. I think we jumped a bunch of this. There we go. So the tired of looking tired. So when our eyes are down, people will say to us, I feel tired or I look tired. People are constantly telling me that I look tired. So I position, and really, as we started doing more Zoom calls over the last 2 years, and people started doing more selfies, people started to notice their eyelid position. And they would come in and they'll say, I look tired, or they say to themselves, I look tired in the mirror. And here's just some different things where you see gentleman on the center is lifting his eyelid. We have someone over here on our right side of the screen taking a selfie with the eyes look a little down. And then we have the person looking at her computer over here, and she just looks tired, not invigorated. So why don't we go on? So on the right-hand slide, this is a patient, we can see this during COVID, where they look tired. The eyelids are down. You can barely see the upper 1/3 of the eyelid. And then we placed a drop on the right side, and they look revived. You look at the eyes are open. You see the full eye, full colored eye, the pupils in the center. So definitely same person, couple minutes apart. From one eye to the other looks much better. This is also, go ahead back real quick if we can. There was a little surgery done here. A little skin was removed from the upper eyelids, and the eyelids were elevated. So the difference between just having tired eyes on the right, this is a post-surgical patient of ours who little skin was removed, but we also elevated the eyelids to get them open and look. Because if you just took off a little skin, and there's a lot of patients will think skin is the problem, it's actually the height of the eyelid, where the eyelashes come out and they're touching just the top of the colored part of the eye. All right, so millions of people have drooping eyelids. So you're not alone if you feel your eyelids are drooping. It's a very common thing. We see it here all day in our office, but people talk about it all the time. If you take a look here, it says millions of people over the age of 40 have drooping eyelids, and which in the medical field we call ptosis. I think most people would not even know that term. It's just really a drooping eyelid, and that's what they feel. They look in the mirror, their eyes aren't wide open, they look tired, they take a selfie, or they're looking at a portrait they had taken, and they're really upset because they just feel like their eyes look small and look tired. And if you take a look here, this is a little scale that we use in our office, and maybe some other offices use. So if you take a look at on the left side at A, if you take a look, the upper eyelid is sitting right about where the colored part of the eye, blue eye, brown eye, green eye, is sitting right where that starts. And you can almost see the whole pupil, which is a dark center. And then if you move over to B, what you can see here is you start noticing, you can see a little more of the upper eyelid up here, and you start to know just a little covering of the colored part of the eye. And then obviously as we move down, you see more upper eyelid and you see less of the colored part of the eye, and now it's starting to touch the pupil. And then over here, you can actually see where the eyelid's low enough where it's coming through the pupil. So low-lying eyelids not only affect your appearance, but they can also affect your eyesight. And here's kind of a gamut of it. So in the past, you know, we didn't have many things to do, and we only did surgery. Typically, we only did surgery when people really came to a severe or moderate type situation. But now we have an FDA-approved prescription eye drop for drooping eyelids or for ptosis that lifts your eyelids and opens them. Now, it's not a permanent solution. It lifts the eyelids quickly. You install it. It comes, as you can see, in a single dropper. Typically, there's 1 day supply in each one, and it lasts for about 6 to 8 hours. And within about 10 to 15 minutes of placing the drop in the eye, your eyes will be more open. By opening it up, it helps increase your peripheral vision, especially superiorly, and it's well tolerated and it's safe to use.
So we have a question.
Yeah.
Does this drop work with clients with Horner syndrome?
It may essentially work because it does activate the muscle for Horner syndrome. That when you have Horner syndrome, it's not the muscle doesn't work, but the nerve to the muscle does not. And therefore, this drop, yes, could provide elevation for you. It would last about 6 to 8 hours.
Okay.
So side effects are very minimal with this drop. In fact, we do dispense it right from our office. We keep our own inventory. And I will tell you that we've had it for months. We were actually one of the sites involved in the FDA trial. And while there are been reported cases of some eye redness, maybe an eye irritation or dryness, which sometimes I think the patients had anyway, but maybe it was exacerbated a little. Some people felt that they had a little blurred vision or headache. No major complications or major side effects from it, and most people tolerated it extremely well.
So we just got another question. Says, I see a side effect can be dry eye. I use Restasis for dry eye. Would I be able to use this? I
would tell you could absolutely try it. And if you had some symptoms or you felt that it did cause your dryness to get a little worse, then we wouldn't recommend it. But if you're being properly treated for dry eye with Restasis and artificial tears, you would continue those other medicines, and I would still be fine with you having a trial of this.
Okay. What about for contact wearers?
Yep, we can still do it. What I would recommend is typically you would put this in before your contacts are on, and then about 10 or 15 minutes later, put your contacts in.
Right.
Okay, so here again was kind of, if you remember earlier, we had that line from normal, or what we call normal, to severe. And again, not everyone has a fully wide open eye, but for the most part, you can see here that we do have different grades. So mild on the left with a little Upneeq, and you can see basically how different, or just more awake, the eye's more open. You can see the color of the eye, the pupils clear, and the patient just looks more awake.
Okay, we got another question. Patient says, I have ptosis in my right eye only. Can I use this in one eye only, and will they be symmetrical?
Well, we would give you, again, this is not a permanent solution. So a trial with the drop in one eye to see how much symmetry it gives you is totally acceptable. Again, the drop lasts around 6 to 8 hours from the time of installation. So even if you used it one time and you felt it gave you good symmetry, you would still have to use this drop every day. The next morning when you wake up, the ptosis will be there again, and you would have to treat it again with the eye drop. And in some cases, we'll find that patients may have some asymmetry between their eyes with ptosis. And when we go ahead, we'll say, let's try it in one eye. And then other times we'll say, let's put it in both eyes and see what the effect is. And a lot of times they'll get a little elevation on the eye that's not drooping, and they'll still have improved symmetry between their eyes.
Yeah. Okay. What about excess skin? Will this help at all?
This will not help excess skin at all. So if you think about it, in fact, some people, if they really feel like they have excess skin, when they put the drop in and elevate their eyelid, they may feel that the excess skin has increased. Because if you think of a window shade or a curtain, when we raise that window curtain, the fabric above it does have to roll. So sometimes you may feel like the little roll of skin got bigger. As you remember if you take a look even over here on the picture we're looking at now, if you take a look at the bottom one, where she has a significant ptosis, put the eye drops in, and now her eyelid is more open. Now, in some patients, they may develop a little roll of skin up there because the eyelid has been elevated. So it is not for the treatment of laxity of skin up top. It is not for the treatment of loose skin or redundant skin. Those type situations can either be treated sometimes, in certain cases, by laser tightening of the skin. In certain cases, we would do a surgical procedure of some removal of the skin to help reduce that. But it is not treated by the eye drop.
Right.
And here we are. You can see here, these are these are photos from our clinic. Again, on the right-hand side, if you take a look before the drop, the pupil, the eyelids covering the pupil on the top portion. And then after the drop, significant improvement, the eyes open wider, still covering a little portion of the upper colored part of the eye, but a nice result, definite difference from top to bottom. And again, not every patient has an eye that is fully open and sits at the top, as opposed to if you take a look here on the right-hand side of the screen, you can see that the patient had more of a drooping eyelid on the right hand and had a little, and compared over here, actually had put the drop in both eyes for that patient who was asking earlier. She has a more significant ptosis on the right side than the left. Put the drop in both eyes. Yes, this eye came up a little, but she still has great improved in symmetry, and the eye looks much more open, and she does well. What you also should notice, again, if you take a look at the top right of the eyelid, you can see that little roll of skin where my pointer is, and it comes down to her eyelashes. When that eyelid is raised, there's not as much showing of the upper eyelid. So there is just a little roll of skin there, but the symmetry is much better. So again, it's not going to do anything for the skin. And when you raise the eyelid without taking any skin, it may look a little, you may feel like you have more skin there than you did before.
Yeah. And one good thing to note with that patient is she doesn't always have that drooping eyelid. When she's tired or she stays up too late or has a little bit too much fun, she gets this little wonky eye. So she puts Upneeq in to help fix that. So it's not something she uses daily.
And she's also a contact lens wearer.
Yeah.
So probably she's over wearing her contacts more, but getting a little drooping eyelid.
Yeah. So question is, are the drops used in both eyes for the patient on the right? So Abby.
Yes. So she did get a little elevation of her left eye, as you can see that, but definitely more significant elevation on the right. And again, we've seen patients who have put it in both eyes when they're in a situation like this, and they get a higher elevation on the left, so they don't use it in both eyes. So part of this would be trying the drop, seeing how you personally respond to it to see how best to get your symmetry.
Right. There's Krista.
And here is Krista. So Krista on her right, on her left, I'm sorry, you can see, end of the day, she was a little tired. She'd been working all day seeing patients, put a little Upneeq in, and again, a little brighter opening of the eye. You can see the distance between the middle of the pupil open. Very nice response, lasts for about 6 hours. On the right side, now here's someone who we put the drop in. You can see that one thing is you notice, so when we raise the eyelids on the patient on the right with this drop, much better looking eye. Eyes are nice and open, much fuller, but she still has some laxity of the skin around her eyes. You can see that up top when we raise, so when you go from the top picture to the bottom picture, you can see that her extra skin actually became a little more noticeable, right? Because we've raised the eyelid, okay? And when you look at the bottom lower lids, she still has some laxity down there. So yes, raising the eyelid with the drop works well, but in this patient, we may consider that to do something for skin tightening. Again, potentially lasering or potentially a surgery around the eyes to take some of that redundant skin or laxity to not only rejuvenate the height of the eye, but also rejuvenate the skin in the periocular or the area around it.
Mhm.
And here's a gentleman on the left. You can see he has an asymmetric ptosis, right? His right eye is a little lower than his left eye. And you can see after drops, he has a significant improvement. He still just has a little asymmetry, but not nearly as noticeable as it was before. Again, if you notice that little upper eyelid plate, because the eyelid is higher, you cannot see it as much, okay? Because the eyelids are up. Okay. Also, one thing, even if you take a look at the bottom of the picture here, he has a great response to this eye drop, looks much more awake. But one thing I would say, if you take a look at the clarity of the skin, this is someone who has a lot of skin damage. So this is someone that they might want to have, if they're using the drop and their eyes are more open, now they don't look tired, but still to make their overall appearance more clear, this is someone who, we want to treat some of that skin damage. And we can talk about that in a couple slides, but this is where we may consider doing some IPLs or what's called a BBL to reduce the browns, and maybe some microneedling to soften the skin, because now the eyes are open, you look more brilliant, but we want the skin clarity to go along with it.
Mm-hmm. So question, do I put the drop in the lower eye pocket or directly on the eyeball?
Either way, it would work. Whichever, instilling eye drops, everyone has their own technique. Some people, yes, will pull the lower eye down and put a little pocket in. Some people enjoy putting their head back and actually putting a drop directly in the eye. Either technique is fine. And, again, for some patients, one is going to work better than the other. So either technique would work fine, because when you close that eye, that medication is going to go all the way around. And again, here's another patient on the right who we also did some Upneeq on. And yes, her eyelids are open and much better. But again, still has, why the eyelids are much more open, things, and it looks much better. She has a little puffiness down here in the lower eyelids, a little laxity of skin. You can see again that we could see the whole border of the upper eyelid skin. And here you can see that we don't see that whole upper plate. In fact, some of the eyelashes are now being covered a little because the eyelid's open. So again, I think a great result. Put in a drop, 10 minutes later, your eyes will go open, you look more awake. But are there other things that, we could consider? And that is, again, maybe a little skin management here, some reds and browns, a little puffiness in the lower eyelids. Maybe, we can do a little fat removal down there, a little skin tightening with a laser or surgery. So, this is part of it. I think Upneeq is a great thing, and it also is what patients are looking for. If just having their eyes open and it's very comfortable, they didn't have to have surgery for that, it's a great result. Also, I've had many patients say, you know what, I'm going to try Upneeq for a couple months here and see if I feel like if I notice that my appearance is better. Two, if I feel like by my eyelids being open, I see a little better and more light's coming in. And then, it's kind of a pre-surgical test that you can do if your drooping eyelid would be that bad that you would consider surgery.
Right.
So in some cases, we have Upneeq, but it's not going to do everything. And this is a case, if you look here on the left-hand side, you can see, she had a significant ptosis. She has significant skin. And we raised, so not only did we do the Upneeq test on and raise it, but we also, at this case, took a little skin off of the upper eyelids. We put a little internal brow lift on the right side to raise the eyebrow off the lateral part of the eyelid. So in this case, surgery was, we corrected the drooping eyelid, and at the same time, we removed a little skin and did just a little eyebrow elevation on the right to give her more symmetry, and looks much, instead of just raising that eyelid up, you can see her upper eyelid plate now. Her eyelids look totally different, more awake, more youthful, more rejuvenated. And the same thing over here on the right-hand side. Again, we had a little drooping eyelid and we had a little extra skin up top. So in this case, we did a surgery. Again, in her case, she was never a patient who had a big eye. So we don't want to take someone and change who they were. So yes, we did a soft elevation of the eye. She has good symmetry, but we also did some skin removal, just as the patient earlier had talked about, where a drop's not enough. So we kind of did a small elevation of her eyelids, but also took a little skin off. So as we were talking previously, we've had some patients come in and they, have had a lot of solar damage from the sun. So you raise their eyelids and now their skin we want to address. So if you take a look on this patient, we have two split pictures. On the left-hand side is before we did any treatments of her skin. She has a lot of sun damage. If you take a look at the UV pictures on the left-hand side, you can see all of the UV damage, those dark little spots throughout her skin. And then what we did was called BBL, which is intense laser light. And that is where it actually excites the brown spots that we've gotten from the sun over time and brings them to the surface, and they fade over 5 to 7 days. Typically, we'll do a series of about 4 to 5 of these treatments. There is no downtime with these treatments. Your skin is not broken. It's not a laser. It's just helping to clear. So BBL, or what we call IPL, helps clear brown spots and reds from our skin. So with that, we have a better tone of skin, better clarity of the skin, better appearance of the skin. And you can see the UV damage from the left side post-treatment, how much it's improved. And also now her eyes are open and her skin looks great. So totally different looking patient.
She looks so much younger.
Yeah.
And this is years later.
Right. And what we'd say with all of with BBL and lasers, we do them and, it's not one stop. So typically when we treat someone with an IPL or a BBL, which is intense pulse light, they will have a series of 4 treatments. And then typically once or twice a year, you're back in the office for us to do maintenance, because we're still going to go out in the sun and we're still going to have some aging changes.
Yeah. So someone has a question. After they put the drop in, do they close their eyes so the drop can take effect?
So what we recommend with all eye drops that we place is that typically you place an eye drop and close your eyes for about 30 seconds to a minute to get maximal absorption. Additionally, in some patients will say that when you close your eye, you can hold your finger right in the corner because that's where your little tear drain is. And by closing that off for 30 seconds, it keeps more of the product on the eye, so you have a higher absorption.
I didn't know that.
Now you know that.
Learn something new every day. Awesome. So I think some things to kind of talk about this is it's a great job because it's for everybody. So it's for someone that just has a little droopy eyelid, like we saw with Abby, or has like a little wonky eye, or someone that has a little bit of an older eye that might be considering surgery and has some laxity, but they need to lift their eyelid and they want to see if they're going to like it. And they just want something to get them through. So it's not a drop that has to be done every day, right? You can just do it when you want to do it. It doesn't make it more effective or less effective. Yeah, I'll get to that. Sorry. It doesn't make it more effective or less effective whether you do it every day or just when you need it. You can use it as you want it. It is not something that is covered by insurance. It is $125 for a 30-month supply.
30-day supply. 30 months would be like a long time.
That would be a long time for a 30-day supply. Thanks. We do have a promotion going on right now that if you buy the 30-day supply, you will get 5 free days to go home with. So you have a couple extra days to play with. And another question.
I do want to correct one thing. Ptosis can have multiple origins. So typically when we have a ptosis, that's called because the muscle's drooping a little and not as strong, that's fine. But in patients who have been born with ptosis, which we call congenital ptosis, this drop may have a little effect, but I wouldn't say that it's going to be as profound. So for, I would say 80–90% of the common variety drooping eyelid, it's going to work fine. There are certain situations where people have musculoskeletal problems or abnormal development, and that may not work as well.
Right. So we do have a question. Says, does insurance cover the laser, surgery, and the drops?
So insurance does 100% not cover the drops. If it's made by its own compounding pharmacy, they do not take insurance. I don't know if you can submit it to insurance, but we do not get involved with that.
Right. You can try on your own to get it reimbursed, but we are not involved in that process.
As far as surgery, typically I will tell you, in the thing of ptosis, where the eyelid is physically drooping down and causing some interference with vision, for that type of situation where the lid margin is low, surgery can be covered by insurance. There are a couple criteria. However, I will tell you, in most cases where you're talking about removing some skin and things like that, that is rejuvenatory, and therefore that is cosmetic. So in my mind, when I do surgery for patients, many times I am doing a part of that surgery which is covered by their insurance, a ptosis repair. That's elevating the eyelid margin. And at the same time, I'm doing a rejuvenatory surgery, and that's where we're taking some skin, maybe transferring some fat in the upper eyelid to make it look more youthful. So potentially a portion of the surgery can be covered by insurance, but this is not something that is typically covered by insurance.
Yeah, and just to touch on that a little bit more, insurance is very strict with their criteria. So if that's something that you're considering, you would call the office and we would schedule you a medical exam where you'll meet with Dr. Roth, and he'll probably send you for some testing to evaluate whether you meet that medical criteria.
And that would be billed to your insurance.
Correct, that visit. The laser, if you're talking about the laser for the sunspots, like we saw a couple slides back, that is not covered by insurance. That is cosmetic. And we do complimentary consultations for all of our cosmetic services. You can come in and see what's best for you, and we can make a program for you. And we already touched on the drops are not covered by insurance.
Yes.
You're welcome. If this is something that you're interested in, if you think Upneeq is for you, all you have to do is call the office. We'll schedule you a complimentary consultation. We'll bring you in. We'll take some photos. We might even trial the drop while you're here and see if it's right for you, and you can go home with it that day. And our phone number's on the screen there.
All right.
So if you want to learn more about everything we do, what we offer here, you can follow us on social media, Facebook, Instagram, Twitter, Gmail, YouTube. We're everywhere. Check our website.
All right. Well, thank you very much. I hope this was helpful, and hope to see you all in the future.
Thanks.